Today's date is April 13th, 2011, and this is Melinda Thunstrom. Hi, Melinda.
Hi.
Thank you for taking a minute and just sharing your health story with us. Melinda came in July of 2010, and she specifically came in with migraine headaches, and they were really problematic. And you want to just tell us the story, Melinda, a little bit, kind of how bad they were, and just kind of the story?
Sure. The migraine had started, and I was throwing up and passing out and had to go to the hospital by ambulance. And they did a CT and everything looked fine. They put me on prednisone and antibiotics and some other medication. Nothing helped, and I was just praying about it and to see what I should do next. And the Lord just said to go see Dr. Joe. And I came in, and he adjusted my neck, and my migraine went from a migraine just to a headache with the first adjustment. And then as we continued to adjust, it got much, much better to where the headaches were gone. And then I had...
Can I interrupt just a second? You also had two spinal surgeries
fusions.
in the cervical neck region, true?
Yes.
And that was those were in
1989 and 2006.
And the chiropractic treatment was actually very helpful, even though you'd had two spinal fusions.
Definitely. And I was told I could never see a chiropractor because of those surgeries, and that was just wrong. I mean, definitely wrong.
Okay, that's helpful.
Great improvement.
Yep. And so then what happened?
Then I had multiple digestive problems, terrible diarrhea, and just weak. My body was just run down and didn't have any energy to do anything, and so we tested for food allergies and found multiple food allergies. And as I got rid of those allergen foods, my digestive system started to heal, and the diarrhea had went away. And then taking the supplements just has gotten my body back into shape, and I'd taken estrogen replacement therapy for many years.
For how many years do you remember?
It was 5 years.
Yep.
5 years for a hysterectomy.
Yep.
And so I quit taking the estrogen and did the estrogen detox, and that was just such a big help for my body.
And even more recently then too, you said you were planning on taking some additional education, and you were concerned about your brain properly processing and recalling and being able to take tests.
Yes.
You want to tell us just real briefly about that?
Yes. The last month I've been doing my class and reading and getting ready. I'll have a test this weekend, and it's just been amazing.
How bad was your memory and your recall 3-4 months ago?
Oh, it was terrible. I mean, I could go from the kitchen to the living room to get something and would completely forget what I was going for. And I'd forget people's names, people that I had talked to all the time, and I'd known for a long time. All of a sudden I'd forget their name when I was talking to them.
And now, what's kind of happened over the last 3-4 months?
Oh, it's improved greatly. I can remember things. It's just great. It's awesome. I can remember people's names. People that I haven't thought of in years, all of a sudden their names I'm thinking about them and remembering their names.
What's exciting about that is the combination of balancing your hormones, getting your adrenal system rebuilt in menopause, and then secondarily supporting your brain neurotransmitters for your proper function and communication from one brain neuron to the next has improved. And that's why you're recalling. So I believe you're going to do great on this test this weekend. You'll probably get an A.
I don't know about an A, but we'll see.
Melinda, is there anything else you'd like to share with any future patients or doctors or students that you feel would encourage them?
I definitely think that the proper nutrition, you have to have proper nutrition, and that without that it causes so many problems in your body, and that going to the doctor and getting on medications for those problems just makes it far worse, because then you have side effects from the medication. But it's just so simple. Find out where your body's at and then eat the right foods and nourish it.
Thank you, Melinda. Just real quick, last question, I promise. When you came in, how many different prescription medications do you recall you were taking?
It was over 11.
11 different prescription medications. And can I ask how old you are? Or when you
46.
At 46, you were taking 11 different prescription medications. And now 9 months later,
I'm down to 2.
you're down to 2.
Mm-hmm.
And how do you feel energy-wise and vitality-wise compared to 9 months ago?
Huge improvement. I mean, I'd say, 85% improvement from where I was 9 months ago.
That you've worked hard. I applaud your hard work and your effort. It pays off, doesn't it?
It definitely does.
Thank you, Melinda, so much. God bless you.
Thanks.